Hello and welcome to another episode of Health Matters. I am your coach, Dr. Michael Chillemi, and in this episode, we are going to start a series. So this is going to be a series about osteoarthritis. So this is going to be the ultimate deep dive in understanding the disease, the anatomy of a healthy joint. So today, I do believe that this is one of the most important health discussions we've ever had on this podcast. We're talking about osteoarthritis. Almost everyone has heard the term arthritis. And in fact, it is one of the most common diagnoses patients hear when they visit a doctor today. After having an x-ray or of a joint or back pain, you're simply told, hey, you have arthritis. And that's where the conversation ends. But what does that actually mean? What exactly is osteoarthritis? Is it simply a part of normal aging, or is it caused by years of wear and tear? Can it be prevented? Can it be treated? Does having arthritis automatically mean you're going to need surgery someday? And perhaps one of the biggest question patients ask me every day in my office: why does my x-ray show arthritis if I've never had pain before? It's a good point. Why? Today, we're going to answer all of those questions and many, many more. This isn't going to be a brief overview. This is going to be a true deep dive into osteoarthritis. We're going to discuss exactly what osteoarthritis is, what happens inside a healthy joint, how arthritis develops over time, why it affects millions of people around the world, and why modern medicine no longer considers it simply a disease of worn out cartilage. As this series continues, we'll also explore osteoarthritis of the spine, how it differs from degenerative disc disease, why it contributes to facet joint dysfunction and spinal stenosis, how to diagnose it, and the full spectrum of treatment options, from conservative care to regenerative medicine and surgery. My goal is very specific and simple. By the time you finish this series, you'll understand osteoarthritis better than most patients ever will, allowing you to make informed patient decisions about your own health and treatment. So, without further ado, let's get into it. So, what exactly is osteoarthritis? So, osteoarthritis is usually abbreviated with the word OA as the most common form of arthritis worldwide. It's a chronic progressive disease that affects the entire joint. I want to emphasize the last three words, the entire joint. For many years, osteoarthritis was described as a disease in which the cartilage is simply worn away over time. It was often referred to as a wear and tear arthritis, suggesting that years of use slowly cause the joint to wear out, much like the thread on a tire. While mechanical stresses can play a role, we know that that explanation is simply incomplete. Modern research has shown that osteoarthritis is much more complex than that. Today's osteoarthritis is considered a disease of the entire joint, involving cartilage, bone, ligament, muscle, tendons, the joint capsule, synovial fluid, and even the nervous system. In other words, every major structure that helps a joint function can become involved during the progression of osteoarthritis. This is one of the biggest misconceptions patients have. Many people believe that arthritis only means cartilage has worn away. Simply not true. Cartilage changes, the underlying bone changes, the joint capsule becomes thicker, Ligaments lose flexibility. Muscles surrounding the joints become weaker. Inflammatory chemicals increase inside the joint. Bone spurs begin to develop. Even the nerves surrounding the joint become more sensitive, making normal movement painful. All of these changes work together to produce the stiffness, the pain, the swelling, and loss of function that the patients experience. This is why two people with very similar x-rays may have completely different symptoms. One patient may have very little discomfort, while the other struggle to perform daily activities. The disease affects much more than what we could see on x-ray. So the first question you might have is, how common is osteoarthritis? One of the reasons this topic is so important is because osteoarthritis affects an enormous amount of people worldwide. There's over 600 million people currently living with osteoarthritis, making it one of the leading causes of pain and disability across the globe. Here in the United States, more than 32 million adults have symptomatic osteoarthritis. If we include people who have arthritis visible on x-ray, but may not yet have symptoms, that number could become significantly larger. As the population continues to age and life expectancy increases, that's a good thing. Experts predict that osteoarthritis will continue to become even more common. But age is only one part of the story. We're also seeing osteoarthritis develop in younger adults. Why? Previous injuries, obesity, and repetitive physical stresses, including poor biomechanics, as you see me adjust my chair, sedentary lifestyles, and certain genetic factors all contribute to the development of this disease. This is why it's no longer accurate to think of osteoarthritis as simply a disease of older adults. I've seen patients in their 20s, 30s, and 40s with significant amounts of arthritic changes, while some patients in their 70s have surprisingly healthy joints. Age, of course, increases the risk, but it doesn't guarantee you arthritis. Likewise, arthritis is not an inevitable consequence of growing older, but a far majority of older patients do have osteoarthritis. Why is it important to understand a healthy joint? Because before we could really understand what goes wrong with osteoarthritis, we have to understand how a healthy joint is designed to function. One of the biggest mistakes people make is focusing only on the damaged cartilage. But if we're going to understand arthritis completely, we have to understand every single structure that works together inside a healthy joint. Think about your knee or your hip or even the small bones and joints in your spine. Every time you move, dozens of different tissues must work together perfectly. The bones provide structure and stability. Cartilage creates an incredibly smooth gliding surface. Synovial fluid lubricates the joint and nourishes the cartilage. Ligaments stabilize movements. Muscles generate force and protect the joint. Tendons transfer muscular forces into movement. The joint capsule surrounds and protects the entire joint. Nerves constantly monitor joint position, movement, and pain. If even one of these structures begin to fail, the mechanics of the whole entire joint begin to change. As we'll discover throughout this episode, osteoarthritis doesn't start with one catastrophic event. It develops gradually through the years of microscopic changes occurring inside each of these tissues. So before we examine what goes wrong, let's look at the remarkable anatomy of a healthy joint. So the complete anatomy of a healthy joint is critical to understand. So we basically understand what osteoarthritis is. The next logical question becomes, what exactly is happening inside the healthy joint. So, to truly understand arthritis, we first must understand what we're trying to protect. The human body contains more than 350 joints, depending on how you count them. There is a little bit of discrepancy. Every one of those joints have an incredible job to do. They allow us to walk, run, bend, lift, reach, twist, grip, perform thousands of movements every single day without us even thinking about them. When a healthy when a joint is healthy, all of the structures work together perfectly. Unfortunately, when even one part of that system begins to break down, it affects every other structure around it. That's exactly what happens during osteoarthritis. So let's take a tour inside the healthy joint. Bones, the foundation of every joint. Every joint begins with two or more bones coming together. For example, in your knee, it's your femur and the tibia and the patella. In your hip, it's the femur and the pelvis. In your shoulders, it's the humerus and the scapula. In your spine, every vertebrae forms multiple joints with the vertebrae above and below it. Many people think bone is simply a hard, lifeless structure. Nothing could be farther from the truth. Bone is actually a living tissue. It consists constantly of changes. It's constantly repairing itself, and it's constantly responding to forces placed upon it. Inside every bone are specialized cells called osteoblasts. Osteoblasts are responsible for building new bone. Then we have osteoclasts, which are responsible for removing old bone or damaged bone. Together, these two types of cells maintain a constant balance called bone remodeling. Throughout your entire lifetime, old bone is continuously being removed while new bone is being formed. This process allows bones to remain strong while adapting to changing stresses placed upon the human body. Healthy bone also stores important minerals like calcium and phosphorus. They protect vital organs and house the bone marrow where blood cells are produced. But when osteoarthritis develops, this normal remodeling process becomes abnormal. Let's now look at the covering of the bones. When we talk about the coverings of the bones, we're going to talk about articular cartilage. And it's one of the most remarkable tissues in the human body. So, articular cartilage is this smooth white tissue that covers the ends of the bones, wherever they meet to form a joint. Its job sounds incredibly simple, but to prevent bone from rubbing against bone, it's a very complicated problem. It accomplishes this in an extraordinary way. Healthy articular cartilage creates one of the smoothest surface found anywhere in nature. In fact, scientists have measured healthy cartilage to have an incredible low coefficient of friction. It's actually smoother than two pieces of ice sliding across one another. Think about how smooth that must be. Every step you take, every time you bend your knee, every time you turn your head, your joints are performing an engineering miracle. Millions upon millions of movements throughout your lifetime occur because this thin layer of cartilage allows bones to glide smooth and effortlessly across each other. Why is cartilage so unique? So, cartilage is unlike any other tissue in your body. Why? It has no blood vessels, it has no direct nerve supply. It has no lymphatic drainage. That means that cartilage cannot simply call for help the way other tissues can when they're injured. If you cut your skin, blood immediately rushes to the area. Inflammatory cells arrive. Healing begins. If you break your bone, the body rapidly begins producing new bone. But cartilage does not have that luxury because it lacks its own blood supply. Cartilage receives nearly all of its nutrients from the surrounding synovial fluid. Think of cartilage like a sponge. Every time you move, the cartilage compresses. Old fluid is squeezed out. When the pressure is released, fresh nutrients rich in synovial fluid is drawn back inside. Movement is literally feeding your cartilage. This is one of the reasons where movement is so important for joint health. Healthy movement makes the joint have its nutrients. Prolonged non-movement, immobility deprives the joint of its nutrients. So you need to move. You have to move. Movement is life. I've always said that. And now you see why. Movement is life. Okay, let's talk about the next part. Chondrocytes, the caretaker of cartilage. Although cartilage contains very few cells, one of the ones it does hold is chondrocytes. You could think of chondrocytes as the maintenance crew of cartilage. Their job is to constantly monitor the cartilage surrounding them. Their responsibility is for producing new collagen. They're responsible for producing protoglycans. They repair microscopic damage that occur during normal daily activities. Under healthy conditions, chondrocytes maintain a delicate balance. Old tissue is broken down, new tissue is produced. As long as those two processes remain in balance, cartilage stays healthy. But when that balance is disrupted, the entire disease process of osteoarthritis begins. That's how fast it happens. So now let's talk about collagen, the framework of cartilage. So we're going to look at the building blocks of cartilage, and then that you're talking about collagen, right? Collagen is the building blocks. Most people have heard of collagen because it's commonly advertised in skin creams and nutritional supplements, but collagen is much, much more than a beauty product. It is one of the primal structural proteins found throughout the body. There are many different types of collagen. The collagen found inside healthy joint cartilage is predominantly type 2 collagen. Imagine building a skyscraper. Before adding walls, windows, and flooring, you first construct a steel framework. Type 2 collagen serves as that steel framework per se. It's not steel, obviously, but it is a framework. It creates the strong framework that gives your cartilage its shape, strength, and ability to withstand tremendous forces. So every time you walk, your knees experience forces that may be 3 to 5 times your body weight. When you run, those forces increase even more. Without this collagen framework, cartilage would simply collapse under those loads. So now we come to another remarkable compound of cartilage. I'm sorry, another component of cartilage, which is the proteoglycans. Proteoglycans, if collagen is the steel framework, protoglycans are the cushioning system. So protoglycans are larger molecules capable of attracting and holding an enormous amount of water. One of the most important protoglycans is called agrican. Agrican acts as a giant molecular sponge. It pulls water into the cartilage. That water allows cartilage to compress under pressure. Remember, talk about the sponge, and then immediately spring back to its original shape. This is why cartilage remarkably acts like a shock absorber. It has that ability. Without protoglycans, cartilage will become dry, less flexible, less resilient, brittle, more susceptible to injury. One of the earliest changes that occur in osteoarthritis is actually the gradual loss of these protoglycans. Long before cartilage disappears, it begins with losing water. So many people are surprised to learn that healthy cartilage is made up of 70 to 80% of water. I need to go get a glass right now. That water isn't there by accident. It serves several important functions. It it distributes mechanical forces evenly across the joint. It reduces friction. It nourishes cartilage. It allows cartilage to deform under pressure and immediately recover once the pressure is removed. Without adequate amounts of water, cartilage becomes brittle and less elastic and much easier to damage. You can also think of healthy cartilage as water-filled cushions. As long as it remains hydrated, it performs beautifully. Once that hydration begins to decline, problems begin to develop. So now we've examined the bones that provide the framework of the joint. We've explored the remarkable structure of articular cartilage. We've learned about the chondrocytes that maintain it, the collagen that gives it strength, the protoglycans that provide cushion, and the water that allows everything to function together. But our tour through the healthy joint is only beginning because cartilage doesn't survive on its own. It depends on several other remarkable structures that keep it healthy, stable, functioning, and nourished every second of every day. Let's continue the journey. Surrounding nearly every freely movable joint is a thin layer of specialized tissue called synovial membrane, also known as the synovium. Although it is only a few cells thick, this membrane is one of the most active tissues inside the joint. Think of the synovial membrane as the maintenance department of the joint. Its primarily responsibility is producing synovial fluid. Synovial fluid is the lubricant that allows your joints to move smoothly while nourish, giving nutrients to the cartilage that covers the end of each bone. Unlike cartilage, which has no blood supply, the synovial membrane contains an extensive network of blood vessels. These blood vessels constantly deliver oxygen and nutrients into the joint while removing waste products produced during normal movement. The synovium also plays a major role in regulating inflammation. Under healthy joints, it maintains a balanced environment that allows the joint to function efficiently. However, when the injured or arthritis develops, the synovial membrane often becomes inflamed. This condition is known as synovitis, and we will discuss its role in osteoarthritis shortly. So inside every healthy joint is a remarkable fluid called the synovial fluid. Many people think it's simply joint fluid, but it's far more sophisticated than that. Synovial fluid performs several essential functions. First, it acts as a lubricant. Every time two pieces of cartilage glide across another, synovial fluid dramatically reduces the friction. Second, it gives it nutrients to the cartilage. Remember, cartilage has no direct blood supply. Instead, nutrients are dissolved within the synovial fluid, slowly diffuse into cartilage each time the joint is compressed and released. Every time you, every step you take, every time you bend your knee, every time you turn your neck, fresh nutrients are literally pumped into your cartilage. Movement feeds the joint. Third, synovial fluid acts as a shock absorber. Because of its unique chemical composition, it distributes force across the joint evenly, protecting cartilage from excessive stress. Finally, the synovial fluid helps remove waste products generated by normal joint metabolism. Without healthy synovial fluid, cartilage cannot and would not survive. One of the most important ingredients inside the synovial fluid is hyaluronic acid. You've probably heard about the hyaluronic acid in skin products, but long before it became popular and famous in cosmetics, it was already performing an essential role inside every single healthy joint. Hyaluronic acid is a large molecule capable of attracting tremendous amounts of water inside the joint. It gives synovial fluid its thick, slippery consistence. Imagine pouring water onto a smooth joint. It runs off really quick. Now imagine pouring honey, that thick honey. It coats the surface. It stays where it's needed. Healthy synovial fluid behaves much more like honey than water. That thickness allows it to coat cartilage evenly while providing excellent lubrication. As osteoarthritis develops, the concentration and quality of hyaluronic acid begins to decline. The joint fluid becomes thinner. Lubrication decreases. Friction increases. This is one of the reasons some physicians use hyaluronic acid injections for certain patients with knee osteoarthritis. The goal is to improve lubrication and reduce pain, although results vary depending on the individual. Okay, we're going to keep going. Next, we're going to talk about surrounding the entire joint is a strong sleeve of connective tissue known as the joint capsule. This is you're going to think of this as a protective envelope. The capsule completely surrounds the joint, helping keep the bones aligned while containing the synovial fluid inside. It also provides stability. Without the joint capsule, many joints would simply move far beyond their normal range of motion. The capsule contains numerous nerve endings that constantly monitor joint position. These nerves send information to the brain regarding movement, pressure, stretching, and pain. In a healthy joint, the capsule remains flexible enough to allow motion while retaining strength, making it strong enough to prevent instability. As arthritis develops, the capsule often becomes thicker and less flexible. This contributes to the stiffness that a lot of people feel with osteoarthritis. Okay, there's more. There's more to the healthy bone, believe it or not. Immediately beneath the articular cartilage lies another critical, important structure called the subchondral bone. The word subchondral simply means beneath the cartilage. Many patients assume cartilage sits directly on solid bone. In reality, the subchondral bone is highly specialized. Its job is to support cartilage while absorbing and distributing forces placed upon the joint. Think of building a house. The strongest flooring in the world won't perform well if the foundation underneath it is shifting. The same principle applies here. Healthy cartilage depends on healthy subchondral bone. During osteoarthritis, this bone begins to remodel itself. Instead of remaining resilient, it often becomes denser and thicker. Doctors refer to this as subchondral sclerosis. Although this remodeling initially represents the body's attempt to strengthen the joint, it eventually alters how forces travel through cartilage, contributing to further degeneration. Okay, now let's talk about covering nearly every external surface of, of bone is a thin but incredibly important membrane called the periosteum. The periosteum contains blood vessels, nerves, and specialized cells involved in bone growth and repair. Unlike cartilage, which contains virtually no pain fibers, the periosteum is extremely sensitive. In fact, many patients experience bone injuries and they're actually not coming from the bone. The actual feeling of pain is coming from the periosteum. They're feeling a pain from those richly innervated periosteum surrounding it. This becomes important during osteoarthritis because abnormal bone remodeling, bone spurs, and inflammation may irritate these areas and cause pain and sensitivity throughout the tissue. Now let's talk about ligaments, the joint stabilizers. Ligaments are incredibly strong bands of connective tissue that connect one bone to another. Their primary function is stability. They guide movement. They limit excessive motion, and they help ensure joints, along with their with their intended path. Without ligaments, joints would become unstable very quickly. Healthy ligaments also contain specialized nerve receptors called proprioceptors. These receptors constantly monitor joint position. Even with your eyes closed, your brain knows exactly where your joints are because of signals sent from these receptors. As arthritis progresses, ligaments function can change. Some ligaments gradually become lax, other ligaments become thicker. Both situations alter the mechanics and increase abnormal loading. Okay. Closely related to ligaments are tendons, although they are often confused. They perform completely different jobs. Ligaments connect bone to bone, tendons connect muscle to bone. Whenever a muscle contracts, it pulls on a tendon. The tendons then pull on the bone, creating movement. Healthy tendons are remarkably strong. Many can tolerate forces several times greater than the body weight. However, when joints become arthritic, surrounding tendons frequently become overloaded. Muscles begin compensating for painful movement patterns. This often leads to tendonitis and additional pain that patients mistakenly assume is coming from arthritis. Okay, perhaps one of the most overlooked components of a healthy joint is muscles. Most people think muscles are simply to create movement. They do much more than that. Healthy muscles act as a dynamic stabilizer. They also absorb shock. They reduce stress placed on the cartilage. They protect ligaments. They improve balance. They maintain posture. And they distribute forces evenly throughout the body. Researchers constantly show that stronger muscles reduce joint loading. This is one of the reasons physical therapy plays such an important role in treating osteoarthritis. We're not simply strengthening muscles, we're reducing abnormal forces acting upon itself. Finally, let's briefly discuss blood vessels in the nervous system. Healthy joints depend on intrinsic networks of blood vessels supplying oxygen and nutrients to the surrounding tissues. The synovial membrane receives an excellent blood supply. Bone receives an excellent blood supply. Muscles receive an excellent blood supply. Cartilage, no blood supply. It depends almost entirely upon the synovial fluid. The nervous system is equally important. Specialized nerve endings constantly monitor movements, pressure, vibration, temperature, and pain. Together, these signals allow the brain to coordinate smooth movements while protecting the joint from excessive stresses. While arthritis develops, many of these pain receptors become increasingly sensitive. Activities that were once painless may gradually become uncomfortable. Over time, even relatively small movements may trigger significant pain because the nervous system itself becomes part of the disease. So we're going to talk about this, and it's going to come up I think in the next episode. It's going to be the fear pain cycle. It's coming, and we're going to talk about it because it's really serious for patients. But I do want to wrap up this episode. We're going to pause for a moment and look at everything we've learned. A healthy joint is far more than two bones meeting together. It's a living, dynamic system composed of cartilage, chondrocytes, collagen, protoglycans, synovial fluid, hyaluronic acid, the synovial membrane, subchondral bone, ligaments, tendons, muscles, blood vessels, and nerves, all working together in perfect harmony. When every structure performs its job correctly, movement feels effortless. But when osteoarthritis, it doesn't attack just one of these structures. It slowly begins changing every single one of them. And that's exactly where we're headed to next. In the next segment, we're going to examine what happens on a microscopic level to osteoarthritis. And we're going to follow the disease step by step from earlier changes to later changes and how bones change and pain. So I'm going to end this episode the way I end all my episodes. The information I've given you today is my opinion alone. Please do not take what I have given you as any medical advice. Again, it's my opinion alone. If you have a problem, please speak to your own personal medical provider. Let them do a full comprehensive analysis on you. And don't forget, so this is number one in a series. I have five in this osteoarthritis. It's a big series. It's a lot of information. We're gonna dig down. We're digging deep. We're digging deep, and we're gonna get you all of it that you want and really understand what osteoarthritis, because it really is one of the most misunderstood conditions. And people just they basically accept where they are as opposed to understanding what's happening and why. As I always say, we got one life. It's important because your health matters. Till next time, I'm Dr. Chillemi. Be healthy, be well.